touch this. You can't touch this. You can't touch this. You can't touch this.
This short video will be on transmission-based precautions. This includes contact, droplet, and airborne precautions. Transmission-based precautions can be defined as the practice of using personal protective equipment to help diminish the spread of infectious disease when in contact with patients' blood, sputum, or other bodily fluids. Precaution we'll be talking about is contact precautions. This is used when pathogens can be transmitted by indirect or direct contact. Indirect contact transmission involves an intermediate step. It begins when a contaminated individual touches an object or an uninfected person. The contaminated individual then passes the pathogen onto a person or object. Direct contact transmission involves physical transfer of pathogens directly from one person to another. Clinicians often wear personal protective equipment or PPE to prevent staff or equipment from becoming infected. Some personal protective equipment used: gowns and gloves. The patient's equipment should be kept in their room and not shared with any other patients. And the patient should also be kept in a private room. Here the clinician is putting on a gown and gloves. First you put the gown on, tie both of the back straps, and then you'll move and put the gloves on. There is a test that you do once the gloves are on and the gown is on, where you raise your hands and arms above your head to the side and then down towards your feet to ensure that there is no gaps between the gloves and the gown. Later in the video we'll go in greater depth into how to take off PPE in the proper order. Some conditions indicating the use of contact precautions are MRSA, antibiotic-resistant bacteria, diarrheal illness, open wounds, or respiratory virus. Another condition is enteric bacteria, which includes C. difficile, norovirus, and rotavirus. If there is enteric bacteria, the clinician must wash their hands with soap and water after doffing. Next, we'll be talking about droplet precautions. This is characteristic of wearing a mask. A mask is used when within 3 feet of the patient. Some PPE used include mask, gown, gloves, and eye protection, even though the only thing required is to wear gloves and a mask when within 3 feet. I highly recommend wearing the gown, gloves, and eye protection along with the mask, because indirect contact, direct contact can happen very easily with the patient. For sure, masks should be used when splashes, spray, or droplets get contact mucous membranes. The patient, if they leave the room, must wear a mask, and they should be kept in a private room as well. Here the clinician is putting on the gown, mask, goggles, and gloves, also using the test to ensure that the gloves do not form a gap between themselves and the gown. The clinician is putting on all of this PPE because the chances of spreading droplet precautions, droplet bacteria, pathogens, is very highly with either indirect or direct contact. The indications for using droplet precautions include bacterial pneumonia, bacterial meningitis, viral influenza, and rubella. Next are airborne precautions. This is characteristic of negative pressure rooms, only allowing air in and not out. Also N95 masks. The PPE used for airborne precautions are N95 masks and gloves. N95 masks must be worn before entering the patient's room. N95 masks most efficient in this situation because it is airtight. Patient is only transported in emergencies and should be wearing a mask. Here is what a N95 mask looks like. To don, place the mask in your hand, pull both the straps over your head, making sure the mask is fitted properly, then put on gloves. A gown would be worn if contact with pathogen is anticipated. Some indications for airborne precautions include measles, chickenpox, Legionella infection, and tuberculosis. Here's the proper order of donning and doffing PPE. Also, some contaminants may still remain after protecting oneself. Doffing is the most important step. 2 to 5% of contaminants comes from removing gloves improperly. Here the clinician is donning the appropriate PPE in correct order. First putting on the gown, the mask, the goggles, and the gloves. A note to remember when donning and doffing, you must remember to wash your hands. I cannot stress this enough. Wash your hands before donning and directly after doffing. The order of doffing this PPE will be the gloves, goggles, gown, then mask in appropriate order. Ensure that you do not touch any of the outside parts of the garments because this is the dirtiest parts of the PPE. Thank you for watching. Here are my references.